Okay, now for the leg region, what we're going to do here is you can actually perform a little bit of a stretch. Anytime you're stretching, so you can bring it down, or you can externally rotate it a little bit and go down more of the hamstring region. But you can actually make a ratchet technique into this too. So extend it out, go down the adductors, bring it back, nothing. Extend it, go down, back, nothing. So that works really good, but with the adductor region, the groin region, it's going to be really tender on most people, so just make sure you perform a little bit slower if you're going to perform a little bit deeper pressure in those regions. Okay, next one, I'm going to have them internally rotate like this, so pushing like this, and they're going to externally rotate like this. So I'm going to have them push, push, and then you can go across the quads or the shin region. And again, you can go a little bit deeper if you want each time. Or you can start with them externally rotated and have them internally rotate like this then, okay? So internally rotate, internally rotate, internally rotate. So again, if you want a little bit more pressure, that it will actually help out some then, okay? Next one, I'm going to cup the calcaneus. I'm going to use my forearm to actually stretch out here and actually go down the quads. But just make sure they have a healthy knee for this region. So when you're performing this, so it's stretching out some of the hamstrings, maybe a little bit, but you can actually bring it up a lot higher if you need to. But the lower the table, the better for this. But it's usually getting the calf region, so the soleus and gastrocnemius, really good for this area. Okay, next one, I'm going to externally rotate like this, flex the knee. I'm actually going to put this on my hip. So I'm going to bring it up like this, hold down the quad. You can actually go down the adductors here, and also a little bit of the semitendinosus and semimembranosus, the medial hamstrings. So you can incorporate that. Also, you can go cross fiber friction over that region too. So it's just a little bit easier access to those muscles, especially the adductors. Another one for the adductors, you can cup the hip and have them try to lift up their knee. So try to lift up their knee and see if you want a little bit more pressure that way. Okay. And then when you come back, nothing. But when you're going down, that's when you want a little bit more of the resistance for that then. But again, with the hip, make sure you're cupping it. Make sure you're not putting pressure right on the hip bone, the ASIS, anterior superior iliac spine region, because you are more likely to bruise that region if you do that then. Okay, next one, you can actually put it above the patella here and do the same kind of motions and try to have them lift up. There we go. Try to lift up. Try to lift up. Okay. Or you can actually have this foot underneath their popliteal. Okay, and then try to lift up. Try to lift up. But you can also just hold it down and have them try to resist you. And go down that way. But otherwise, if it's, again, most people, it's going to be really tender in this region, so you don't even need to do that. But if the client is really not flexible at all, you can put a bolster or a pillow or something underneath, right underneath here, so it's a little bit more comfortable for them. Or you can actually, if you don't want oil or anything on you, just wrap a towel, just rest it like this, so it's another position that you can actually incorporate these techniques into it then, okay? So that's for that region. Then you can also, I'm going to have the knee flexed. Okay, so knee flexed like this, and I'm going to pull it this way. So I'm going to pull and then go down the quad. So you need to do a ratchet technique with that. So pull, slide down the quad. Pull, slide down the quad. Pull, slide down the quad. But I'll show you what we actually did here. Is here, we pulled it this way so you can stretch out a little bit of the gastroc and soleus regions through the calves. So you can do a little stretch like that then, okay? Okay, next one, what we're going to do is we're actually going to bring it over here like this, and I'm going to pull the knee towards me and go down the lateral side of the leg. So just pull it a little bit each time you're going down that region. So a little bit more. Okay, next one, what I'm going to do, I'm actually going to use her foot on my hip bone. So you can do a little bit more stretched. You can actually get the biceps femoris right here. So you can walk it in a little bit, give it a little stretch. But again, you can go a lot slower with these techniques, try to get a little bit more pressure. So just make sure you're aware of any tender areas. But the nice thing about these techniques is it actually gives them a little bit of stretch, and the average person does not stretch on a regular basis, so they're going to need these kind of techniques then. You can also put your body in here too, okay? So the one before, we have it on the hip, but now we're going to actually have my body in here, so resting right on my hip, so you can actually walk it in a little bit to get a little stretch. So you can get the TFL region, the vastus lateralis, also the biceps femoris. It's a little bit easier access for you when you perform this thing. Okay, next one, if they're not really that flexible, you might have to just bring it over here like this. So the leg is not over here like we did for some of them. We're going to have it right here, bring it over, and then go down. But again, they can actually do some resistance if you need to, increase the pressure. But also the ratchet technique usually works really nice. And especially for some of those therapists that it's hard to actually just stay in one spot for long periods of time. These techniques keep you busy the whole time then. Okay, next one, I'm going to perform abduction. So abduction, away. So I'm going to use my hip right at the medial side of the knee. So like this. And then you can actually go down the adductor region for a little bit of pressure. And if you want a little bit more, you just walk it up and go down the adductors here. But if you have the foot totally rotated out, if the foot is totally rotated out like this, that's more of a hamstring stretch. But if the foot is totally up like this, that's more of an adductor stretch. So it's actually stretching the adductor region, so the area you're concentrating on more. But again, when the foot is pointing straight like this, not